Hi, welcome everyone for this webinar organized by Student Network Organization. I am so happy to be to deliver this session for my student this morning. This webinar is organized by Africa-EMRO region of Student Network Organization as a scientific webinar on COVID-19 prevention. My presentation is about expected role of the medical student in EMRO and Africa region during COVID-19 pandemic. I am Al-Hadi Miskin, and I'm assistant professor of OB/GYN in University of Jazeera, Sudan, and head department of OB/GYN University of Bisha, Saudi Arabia. I am following femur fellowship Institute Asia of Raimina, batch 2021. The outline of this presentation, it will be firstly about the dilemma of COVID-19 pandemics, role for medical students during COVID-19 pandemic, and then take home message, recommendation, conclusion, and discussions. All humanity should work together to roll back COVID-19 these days. On late January, WHO declares that COVID-19 a public health emergency of international concern. Since the beginning of these outbreaks, all concern authority everywhere in the world, including WHO, has worked with the countries and areas across the regions to share the last evidence, prepare and implement the national response. And as you see here in this map, disease distribution everywhere in the world has never been safe from this pandemic. Africa has an first response to COVID-19. The WHO Regional Office for Africa hosted the first virtual event, bringing together more than 100 leading innovators from across sub-Saharan Africa to be the pioneer creative local solution to the COVID-19 pandemic and address critical gaps in the regional response times. COVID-19 and healthcare system worldwide, the spread COVID-19 is putting extreme pressure on the health system globally. However, the clinical academics and recently retired doctors has been brought back into the clinical practice. Clinical rotas has been reorganized. Final years medical students who have been deemed to have reached their competence are graduated early as well. Final years medical students in Italy, USA, UK can register to work and apply their skills early to assist in the COVID-19 pandemics. In the UK, recently, senior medical doctors are being offered the opportunity to begin their postgraduate training early, involving professional registrations and interim contract with similar terms to the senior doctor. In Africa and EMRO as well, students enroll in a multiple activity at the all level community clinical settings and vulnerable group protection. But we should raise several safeguards to protect our new doctors from any hazard during this pandemic. Assignment of a named medical supervisor, direct supervision, when seeing actually unwell patients, and daytime working hours is very important. It is expected that new doctors would be deployed in supporting area, avoiding COVID-19 ward and intensive care unit where is possible. The students are willing to able to fight in this history and this historic pandemics and should be given the opportunity to do so. This is very important historical event in their life and should be involved. In addition to the benefit to the patient and to the healthcare system, allowing students to participate reinforce important values such as altruism service in times of crisis and solidarity with the profession. This is a golden chance for them and should do work. Medical student can post the efficacy of light staffed clinics by taking histories, calling patients with laboratory test results, providing patient education, documenting visit and fielding question about COVID-19. Even in a pandemic, patients with a chronic condition need ongoing care. This actually can serve in this area. Pregnant women need a routine checkup, and discharged patients require follow-up as well. Many of these tasks can be performed via telemedicine, so there would be no risk for infectious transmissions. Medical students can remotely assist in care of patients with COVID-19. They can monitor patients with mild COVID-19 symptoms who are not admitted at the level of community. So it is very important for the medical student to participate in their community empowerment. Local community should be empowered, leading by medical student, community participation, community members, leaders, and or group participate in one or more phases of an activity or project. Participation may involve contribution of ideas, priorities, resource, times of decision-making, implementation, and evaluation. This area can be led by the medical students. The goal of participation is to give the communities ownerships. Ownership is very important for the community and to empower the community of our local communities, the ability to express themselves, to learn from them, and ultimately to empower them through the transfer of skill, abilities, and knowledge. Participation is a process often leading to some others in the project. So community empowerment through participations and transfers of skill, communities assume responsibility for identifying problems, prioritizing needs, mobilizing resources, negotiating, planning, implementing, and evaluating activities for the common good on the ongoing basis. Very important. The goal of community empowerment is to enable and empowerment is the end product of the project. Also, one of the vital roles of medical students can mobilize their community, and the community or a group within the community organize around a particular issue with or without promoting outsiders. Community members work together to resolve the issue or overcome the problems. For example, communities often mobilize to build their own schools, so they can also mobilize to share the responsibility in COVID-19 prevention. Once this is accomplished, they may or may not continue to work together or address other issues. The goal of community mobilization is to solve particular problems. We are really in need to address this issue. Here is example of characteristic of empowered communities. All sectors or groups must have a voice in the decision making in elsewhere. Concern for the common good prefers over personal ambitions. The community recognizes the prioritized needs for all members. Community can take action locally to solve problems, change behaviors, or access services as well. Community is able to plan, implement, and evaluate activity or project of their own. But there is challenging clinical situation facing our medical students to be involved in this pandemic prevention. Exposure to difficult decision makers and end-life scenarios. Proper supervision will be reduce medical errors. This is a very important area we should to be considered, and always should be supported by a senior support. And this form of involvement would require appropriate personal protective equipment. Staffing hospital service with the upper level students could maximize the availability of other clinicians to treat patients with COVID-19. This is very important. So what about this pandemic and education? The pandemic should not be a time of educational status. It is a chance of it is chance of the medical student to harness the power of technology and the novel educational tools. All medical institutions should rely on this. Digital inductions and virtual webinars and with educational supervisors are one possibility. And medical schools are adopting this widely to deliver final set of lectures and even high-stake exams. It's very important, and this should be considered with any university or medical institutions. These steps are necessary now, but also be used to supplement invaluable face-to-face contact in the future. The COVID-19 pandemic will make a medical student better doctors. We should believe on this. Such a realization can and must change everything about the way of medical students perceive their professions, as well as everything about the way first generation physicians are trained. Social determinants we now know have tremendous impact on his or her well-beings in the community levels, which is why the disease rate can vary widely even among residents in the same city or live in different neighborhoods. It is a valid approach to encouraging health science students and the graduate to choose to practice in a more socially responsible way. We should do all of us to work on this. However, improvement of placement and supervision methodology and practice should be explored at faculty levels and implemented in the future programs. The prevalence emphasis in health education is on understanding and changing lifestyle choice and individual health behavior related to the health status. We are really in need for the unique and adaptable guidelines and barriers to address the barriers to the community empowerment approach for the health education practice. It's very important. In developing countries, it is the time to address the health outcome associated with social determinants of health. Physicians, policymakers, communities, and individuals should understand the role of these factors play in individuals and community health. It's very important. And reach the largest number of people while targeting the day-to-day needs individual in their communities. In the last 2 weeks, we are participated in webinars organized by Student Association of the African Association of Medical Students capacity trainings toward COVID-19 preventions. We have students from elsewhere, from Cameroon, Ethiopia, Kenya, Nigeria, Sudan, Tanzania, Uganda, and South Africa, Somalia, and New Somalia. From everywhere in Africa, we have a participant at that training sessions. I asked them to explore their attitude toward community empowerment researches. I found, fortunately, I found that a lot of them, about more than 70%, believe that the research activity should be carried on during this pandemics. And we found them, most of them also interested in clinical, in laboratory and community-based research, and they are intent to participate in empowering their local community. And this is very important to explore our new generation doctor for the future in this regards. Before the end of this session, I would like to acknowledge and to extend my thanks to my institution, University of Jazeera. University of Jazeera, where I led the principles of community empowerment principles. And now I shift to the new institution, and thank you for the support of University of Bisha in Saudi Arabia. As a take-home message, as a medical student transitioning to the new role as a doctor, community empowerment, we hope to bring with us associations, passions, and desire to innovation. We should to have a desire to be innovative, and we should to act in an innovative way. How medical educators respond to the pandemic may set up we said was how we manage a medical student to junior doctor transition in the futures. Always seek a junior support when face the challenging situations. You should to seek support of your seniors always, especially when you challenge situation that fall outside of your skill set. The pandemic offer a chance to harness the power of technology for education. Never has opportunity being greater for the senior medical students to learn by becoming a core part of the professional community. You should take a part of the responsibility to empower your local community by anyhow and in innovative way. This we should take it. This the reference I depend on, and by the end of this session, I would like to thank the organizing committee for invitation to participate in this very important webinars. A special regard to my mentee, Yasin, Mujahid, and Hajir. It is my pleasure to extend my thanks that I have been their mentor in some extracurricular activity. And here I thank my students. They always inspire us. Thank you very much. And be in contact on this email. Thank you. Thank you very much. I am happy to be with you. Thank you.